there was a outbreak of what looked like Parkinsonian symptoms in a young population. Somebody created MPTP, and what ended up happening was a large number of young people who were opioid addicts became completely boxed in, paralyzed. Couldn't speak, couldn't blink, couldn't do anything, couldn't function, couldn't move. I want to share with you two anecdotes, one from my own life and one from some fairly recent history that illustrate some of the core biology of dopamine and how profoundly it can shape our experience. The first one is a really tragic situation that occurred. This was in the 80s. There was a outbreak of what looked like Parkinsonian symptoms in a young population. So many of you heard of Parkinson's disease. Parkinson's disease is a disease in which people initially start to quake, can't generate smooth movements. They'll have issues with speech, sometimes cognition as well. There are examples like Michael J. Fox, which are early onset Parkinson's. Typically, it hits people a little bit later in life. There's a genetic component. But there is this question, and there's always been this question, whether or not certain lifestyle factors can also create Parkinson's. And some years ago, there was a situation where street laboratories, illicit laboratories, were trying to make a drug called MPTP, which is an opioid-like compound. It's a bit like heroin. And heroin addicts seeking heroin went out and bought what they thought was MPTP. Unfortunately, it was not MPTP. It would have been tragic if it was anyway, because they were drug addicts. But what they ended up taking turned out to be a lot worse. What they ended up taking was MPTP, and MPTP can arise in the synthesis of MPTP. So someone in a lab someplace, this was mainly in the Central Valley in California, but elsewhere as well, somebody created MPTP, and what ended up happening was a large number of young people who were opioid addicts became completely boxed in, paralyzed. Couldn't speak, couldn't blink, couldn't do anything, couldn't function, couldn't move. So both aspects of dopamine transmission were disrupted. They had no motivation and drive. They couldn't generate any movement of any kind. They were literally locked in, frozen. And sadly, this is irreversible. It's irreversible because what MPTP does is it kills the dopaminergic neurons of the substantia nigra, that nigrostriatal pathway that's involved in generating movement, and it kills the dopaminergic neurons of the mesocortical limbic pathway. I was in college when this whole MPTP thing happened, and I remember hearing this story. At the time, I had no understanding of what it is to have very high levels of dopamine or extremely depleted levels of dopamine. There was no reason why I should have that understanding. Of course, I had experienced different pleasures of different kinds, and I've had lows in my life, but nothing to the extreme that I'm about to discuss. I got Giardia, and Giardia is a stomach bug that, if any of you ever had it, it is terrible. It's terrible diarrhea. You end up very dehydrated very quickly. You drop a ton of weight, and it is extremely unpleasant. I ended up going to the emergency room, and in the emergency room, I begged them for something to stop up my guts, and they gave it to me. They put a saline line in to rehydrate me, and they injected something into the saline bag, and within minutes, I felt more sadness, more overwhelming sense of depression, basically lower than I'd ever felt in my entire life. It was absolutely profound. I was crying endlessly without knowing why I was crying. I was miserable. And I asked them, what did you inject? And they said, we injected Thorazine. Thorazine is an antipsychotic drug. It's actually used to block dopamine receptors. It's what's given to people who have schizophrenia, often is given to people who have schizophrenia, because schizophrenia involves, among other things, elevated levels of dopamine. It was horrible. The experience of it was miserable, unlike anything I'd ever experienced. And so I actually said to them, what did you give me? They said Thorazine. And I said, you have to give me L-dopa. You have to give me something to get my dopamine levels back up again. And they did. They gave me an injection of L-dopa into the bag, went straight into my bloodstream, and within minutes, I felt fine again. It was incredible, and it really opened up my mind and my experience to what it is to have absolutely plummeted levels of dopamine. There's nothing more miserable than that, I'll tell you. And these poor souls who had this MPTP experience, unfortunately, they couldn't recover those cells. People who have severe Parkinson's are struggling with this as well, because in Parkinson's and in Lewy body dementia, the dopaminergic neurons often die.